Moa Mechanism of Action. This refers to the specific way in which a drug or therapeutic agent produces its effects in the body. It explains the biochemical and physiological processes through which the drug interacts with its target and leads to the desired therapeutic outcome. Infection, inflammation. Infection is the invasion and proliferation of microorganisms like bacteria, viruses, or fungi in the body, leading to tissue damage. Inflammation is the body's response to infection or injury, characterized by signs and symptoms such as redness, swelling, pain, and heat. Signs, symptoms of inflammation. These can include redness, swelling, pain, heat, and loss of function. Acute inflammation occurs rapidly and is short-lived, while chronic inflammation persists for an extended period. Complications of extended antibiotic use. Prolonged antibiotic use can lead to antibiotic resistance, disruption of the normal gut flora, and side effects like allergic reactions or secondary infections. Peak, trough of antibiotic dosages. Peak refers to the highest concentration of an antibiotic in the bloodstream after administration, while trough is the lowest concentration before the next dose. Monitoring these levels is crucial to ensure therapeutic effectiveness and prevent toxicity. Antimicrobial stewardship. This involves responsible and strategic use of antibiotics to minimize resistance, reduce adverse effects, and optimize patient outcomes. Principles of bacterial mutation and proliferation. Bacteria can mutate, leading to antibiotic resistance. They proliferate through binary fission, rapidly increasing their numbers. Cells of inflammation. Neutrophils, basophils, eosinophils. These are types of white blood cells involved in the inflammatory response, each with specific functions. Viral versus fungal versus bacterial infections. Differentiating between these infections is based on clinical presentation, laboratory tests, and microscopic examination. Viral infections are caused by viruses, fungal infections by fungi, and bacterial infections by bacteria. Purulent versus serous versus fibrinous versus membranous exudate. These terms describe the characteristics of inflammatory exudates. Purulent exudate is thick and filled with pus, serous is clear and watery, fibrinous is thick and sticky, and membranous forms a membrane-like layer. Cardiac. This category pertains to various aspects of heart health and cardiac conditions. Coronary blood flow. This refers to the blood supply to the heart muscle. Pathological conditions can lead to reduced blood flow, causing ischemia and myocardial infarction, heart attack. Right heart versus left heart function. The right side of the heart pumps blood to the lungs for oxygenation, while the left side pumps oxygenated blood to the rest of the body. Atrial fibrillation. A common cardiac arrhythmia characterized by rapid, irregular atrial contractions. It can be identified on an EKG and managed with medications or procedures. CAD, coronary artery disease. A condition where coronary arteries become narrowed or blocked, reducing blood flow to the heart. Stable angina occurs with predictable triggers, while unstable angina is unpredictable and can be a sign of impending heart attack. Hypertension, HTN. High blood pressure, which can lead to cardiovascular complications. Medications are used to control it, and their mechanisms, contraindications, and interactions with patient medical history must be considered. Heart failure, HF. A condition where the heart is unable to pump blood effectively. Different tests can assess prognosis, and medications like beta blockers and diuretics are used in treatment. Left ventricular hypertrophy, LVH. Thickening of the left ventricle's walls due to chronic high blood pressure or other conditions. Valve pathology. Mitral stenosis, mitral regurgitation, aortic stenosis, aortic regurgitation. These conditions involve problems with heart valves, affecting blood flow within the heart. Collateral circulation. Development of new blood vessels to compensate for reduced blood flow in certain areas. Arrhythmias. Tachy, brady, AFib, SVT, VFib. Abnormal heart rhythms that can lead to various symptoms and require specific management and medications. ACS. Acute coronary syndrome. A group of conditions, including heart attack, STEMI and NSTEMI, where there is a sudden reduction of blood flow to the heart. STEMI versus NSTEMI. different types of heart attacks based on EKG findings. STEMI involves complete blockage of a coronary artery, while NSTEMI involves partial blockage. Diagnostics. Tests and assessments used to diagnose ACS, including EKG, troponin levels, and angiography. Symptoms. Chest pain or discomfort, shortness of breath, nausea, sweating, and pain radiating to the arm, neck, or jaw are common symptoms. Gender differences in ACS symptoms. Women may experience different or atypical symptoms compared to men. Meds to pay attention to. Generic names and information about the mechanism of action, indications, side effects, adverse effects, and contraindications for administration of specific medications. 1. Examples include penicillin, antidiuretic, beta blockers, vasodilators, aspirin, vancomycin, ARBs, angiotensin II receptor blockers, ACE inhibitors, Lasix, furosemide, digoxin, doxycycline, calcium channel blockers, and antivirals. Penicillin. 1. Indications. Penicillins are antibiotics used to treat various bacterial infections, including streptococcal infections, skin and soft tissue infections, respiratory tract infections, and syphilis. 2. Mechanism of action. Penicillins interfere with bacterial cell wall synthesis, leading to cell wall damage and bacterial death. 3. Contraindications. Allergy to penicillins, as severe allergic reactions can occur. 4. Common side effects. Allergic reactions, rash, itching, swelling, diarrhea, nausea, vomiting. Antidiuretics. 1. Indications. These drugs are used to manage and treat cardiac arrhythmias, abnormal heart rhythms, such as atrial fibrillation and ventricular tachycardia. 2. Mechanism of action. Antidiuretics work by affecting the electrical conduction in the heart, either by slowing down or increasing the rate of electrical impulses. 3. Contraindications. Hypersensitivity to specific antidiuretics, certain heart conditions, and specific drug interactions. 4. Common side effects. Arrhythmias, dizziness, fatigue, nausea, blurred vision. Beta blockers. 1. Indications. Beta blockers are prescribed for various conditions, including hypertension, angina, heart failure, and certain arrhythmias. 2. Mechanism of action. They block the effects of adrenaline, reducing heart rate and blood pressure. 3. Contraindications. Severe heart block, certain lung conditions, and certain drug interactions. 4. Common side effects. Fatigue, dizziness, bradycardia, slow heart rate, and potential exacerbation of asthma symptoms. Vasodilators. 1. Indications. Vasodilators are used to relax and widen blood vessels, making it easier for the heart to pump blood. 1. They are employed in conditions like hypertension and heart failure. 2. Mechanism of action. They relax the smooth muscle and blood vessel walls, leading to vasodilation and decreased blood pressure. 3. Contraindications. Hypotension, certain heart conditions, and specific drug interactions. 4. Common side effects. Headache, flushing, low blood pressure, and reflex tachycardia, increased heart rate. Aspirin. 1. Indications. Aspirin is an antiplatelet and analgesic medication used to reduce the risk of blood clot formation, prevent heart attacks, and relieve pain and fever. 2. Mechanism of action. It inhibits platelet aggregation, reducing the risk of clot formation. 3. Contraindications. Allergy to aspirin, bleeding disorders, and certain gastrointestinal conditions. 4. Common side effects. Gastrointestinal irritation, bleeding, and potential allergic reactions. Vancomycin. 1. Indications. Vancomycin is an antibiotic used to treat severe bacterial infections, particularly those caused by methicillin-resistant Staphylococcus aureus, MRSA. 2. Mechanism of action. It disrupts bacterial cell wall synthesis, leading to cell death. 3. Contraindications. Allergy to vancomycin and certain kidney conditions. 4. Common side effects. Nephrotoxicity, ototoxicity, hearing loss, red man syndrome, flushing and itching. ARBs, angiotensin II receptor blockers. 1. Indications. ARBs are used to manage hypertension, heart failure, and diabetic nephropathy. 2. Mechanism of action. They block the action of angiotensin II, a hormone that constricts blood vessels and raises blood pressure. 3. Contraindications. Pregnancy, hypersensitivity to ARBs, and certain kidney conditions. 4. Common side effects. Dizziness, hypotension, cough. Less common than with ACE inhibitors. ACE inhibitors. 1. Indications. ACE inhibitors are prescribed for hypertension, heart failure, and kidney disease. 2. Mechanism of action. They inhibit the conversion of angiotensin I to angiotensin II, leading to vasodilation and reduced blood pressure. 3. Contraindications. Pregnancy, hypersensitivity to ACE inhibitors, and certain kidney conditions. 4. Common side effects. Cough, elevated blood potassium levels, and hypotension. Lasix, furosemide. 1. Indications. Furosemide is a diuretic used to treat edema, fluid retention, associated with heart failure, liver disease, and kidney disorders. 2. Mechanism of action. It promotes the excretion of excess sodium and water by the kidneys. 3. Contraindications. Allergy to furosemide, anuria, lack of urine production, and certain electrolyte imbalances. 4. Common side effects. Electrolyte imbalances, low potassium, sodium, and magnesium, dehydration, and dizziness. Digoxin. 1. Indications. Digoxin is used to treat heart failure and certain arrhythmias, especially atrial fibrillation. 2. Mechanism of action. It increases the force of heart muscle contractions and slows the heart rate. 3. Contraindications. Ventricular fibrillation, certain heart conditions, and specific drug interactions. 4. Common side effects. Nausea, vomiting, bradycardia, visual disturbances. Doxycycline. 1. Indications. Doxycycline is an antibiotic used to treat a wide range of bacterial infections, including respiratory and skin infections. 2. Mechanism of action. It inhibits bacterial protein synthesis, preventing bacterial growth. 3. Contraindications. Allergy to doxycycline, pregnancy, and certain liver conditions. 4. Common side effects. Gastrointestinal upset, skin photosensitivity, and potential allergic reactions. Calcium channel blockers. 1. Indications. Calcium channel blockers are used to treat hypertension, angina, and certain arrhythmias. 2. Mechanism of action. They block calcium entry into heart and smooth muscle cells, leading to vasodilation and reduced heart rate. 3. Contraindications. Heart block, certain heart conditions, and specific drug interactions. 4. Common side effects. Dizziness, hypotension, and constipation. Antivirals. 1. Indications. Antivirals are used to treat viral infections such as influenza, herpes, and HIV. 2. Mechanism of action. They inhibit viral replication and reduce viral load in the body. 3. Contraindications. Hypersensitivity to specific antivirals and certain drug interactions. 4. Common side effects. Nausea, diarrhea, headache, and potential adverse effects specific to each antiviral. Understanding the indications, mechanisms of action, contraindications, and side effects of these medications is crucial for healthcare professionals to make informed decisions when prescribing, administering, or monitoring patients.